It's very interesting, and I'm curious from your perspective, it seems like we know more about OPMD than we have done in the past. So what is kind of the miss, or why haven't we translated some of what we know into therapeutics? Obviously, it's kind of the big question across a lot of disorders, but talk a little bit about some of the challenges and barriers from taking what we know about OPMD and translating it into therapy.
Yeah, there have been trials in the past. And probably the largest was a trial with a drug called trehalose, and unfortunately a phase 2 was exciting and a phase 3 was not successful. So then there was this sort of pause until we got into this new gene therapy era, and that's what we heard about at this meeting, and actually we heard about it at, I think, World Muscle Society last October, is that there is now a new technique where there's a gene therapy that has a cassette that includes a normal copy of the gene, but it also includes part of the transcript can produce 2 separate interfering microRNAs. So these microRNAs will interfere with the abnormal protein product, or the abnormal RNA transcripts, and then you still have the normal copy. So it's sort of a knock down and replace. And that's a very interesting model that is currently in humans after being used in beagles for swallowing, but now it's in humans, and it's an interesting strategy where they're actually directly injecting, and we didn't actually see the injection, but it's almost like a tattoo along these muscles to, under surgical procedure, inject into the superior and inferior pharyngeal muscles. And the hope is that that will allow for better quality swallowing. And I think there are now 2 or 3 patients that have been dosed for which we have some data. And there is data saying that pre-dosing the swallowing is a certain level of abnormality. And then post-dosing, the improvement over 2, 4, and 6 months has been improved swallowing with better quality of life related to the swallowing.
Very interesting. I'm also curious from your perspective, not that you speak for the entire clinical community, but what is the feel amongst other clinicians who also help patients out with OPMD? What's the thought and feel on gene therapies and genetic approaches? Because if you talk to a lot of different people, especially at this conference, depending on what disorder you're talking about, you'll get a ton of different answers and a ton of different takes on what gene therapy could do and the potential of it. So what is the feel of what gene therapy could do? And also to that same point, are there any genetic-based approaches or vehicles that we feel as though would be best for this type of disease? We obviously talk a lot about AAV vectors and the actual way that we're going to prescribe or give gene therapy. So what's the thoughts on any of that as well?
The current model is to use an AAV vector with the transcript. But the challenge is that it does not have to be AAV. It is in this case, but it could be any delivery mechanism. But the big challenge is it's not a gene replacement therapy, a gene transfer therapy, because you really cannot just give another copy, because then you'd have 2 good copies and still have the bad copy producing all the trinucleotide repeats RNA sequences that then develop inclusions, and then you have degeneration. So it really is unique in that it's a combo therapy in this one cassette transcript, which is that you have both the normal copy being replaced, and then you have the 2 interfering RNAs that are part of that transcript. So I think that's what has taken a while, is that there are certain programs that are preclinical that have looked at just the interfering RNA strategy, others that have looked at other strategies, but the combination seems to be that it would work the best. And it's, in my mind, a very smart move, because the FDA usually will want to see a direct muscle injection before you move on to broader therapy. And in this case, it's a wise move to say, okay, usually we take a muscle that in somebody that's so weak it doesn't matter if you lose it. In this case, it's proof of concept would be if it works in a single muscle direct injection into a muscle in need, then maybe you could think about either doing more systemic therapy or combination therapy where you could do levator palpebrae in addition to the swallowing muscles. So I think you could either do multiple injections or you could look at going to systemic therapy. But that's maybe a few years down the road because we still have to make sure that this works.